All evacuations are lifted for the Spokane Area Fires, but the recovery is just beginning. This morning we have Dr. Francisco Velázquez with the Spokane Regional Health District with us. You're the health officer for the county. Good morning. Thanks for being here.
Good morning. Happy to be here today.
I want to jump right in and talk about, it is going to be a long road to recovery. People are getting back to see the destruction, and there's some health concerns and safety concerns we want to talk about. What's the messaging from the health department?
So I think we need to remember it's a complex fire, meaning a lot of structures, vegetation. That means the composition of smoke and ash is different depending on where you are. There are some things that everybody needs to be mindful of as they approach their home again, and it all depends on the amount of damage that could be there.
Sure.
So a visual inspection, making sure you're aware of your surroundings. If there are any utilities that don't look like they're working, please call the utilities. And we do know that in structural fires, a lot of things burn that can cause long-term harm if they're not managed appropriately, like asbestos or lead, toxic metals, etc. So I think what we're telling people is, particularly those that were heavily impacted, with the health officer order, we have allowed the process of the EPA to move a little bit further and faster in removing some of the immediate hazardous materials that are there, like batteries and propane tanks. And if they see anything that looks like asbestos, although they're not doing asbestos removal, but if you see a pile of roof tiles being burned, that could look like asbestos. So people need to be mindful of the surroundings and what's in the home. Once areas reopen, there's still some concerns, and for all of us, regardless of how far we are, we still have air quality issues to be mindful of.
Right, totally. And you talked about the long-term health effects. Obviously, it really determines on what they're exposed to. But what are some major concerns in a situation like this? What could be a result of a long-term health effect if you're exposed?
So one of the things that we worry about is long-term impact to your respiratory cardiovascular system. And for example, if you have a long-term exposure to asbestos, hopefully no one will be long-term exposed, you can be concerned about things like lung cancer or mesothelioma. But what I want everybody to remember is that short-term exposures may not cause long-term harm, but even short-term exposure still cause some harm to your lungs and your heart. That's why we're asking people, if you're going to be outside and the AQI is pretty high, make sure you're wearing your mask, because all those small particulate materials are still getting into your lungs.
So talk about the resources available for people affected now going back to their property, and they might want to be collecting things or going back. Is there PPE available for people directly impacted? So
3 things I want people to do before they go back to their place. 1, look at our website. We have a site, what to do after a fire. 2, look at the Spokane Clean Air Agency website about various resources for the assessment of toxic materials. And 3, make sure you get one of the kits from the American Red Cross that has all the PPE you need to go back to your place safely. Don't bring children and pets on the first pass. Make sure that adults do an assessment before you bring children and pets.
Dr. Velázquez, you've been doing this for a long time. Have you ever seen anything like this in our community?
Been practicing medicine for a lot longer than I want to say in many places, and public health for many years, and I don't think I've ever seen anything like this. Actually, I went through all of the sites that were heavily impacted with members of the EPA, et cetera, to see, and I had no words to describe it, basically.
Wow. Well, Dr. Velázquez, thanks for what you and your team is doing. Again, be sure to check out the Spokane Regional Health District's website for all the information. We'll be right back.